So this cupboard is solely for emergency equipment. We also have on the bridge, we've got an AED up there, and I believe that is all. In this cupboard here is a fantastic guide for emergency procedures or clinic leaders manual, which is fantastic. It gives a great overview of a lot of the different equipment that we've got on store, going into quite a good detail. Talk about automatic blood pressure cuffs, an oxygen saturated monitor, the Guedel Airways. It goes through quite a bit of detail in here. So if I was faced with a situation, one of the first things I would do would be to bring this out just to have it for reference on the bench here. So a good thing to know is this is for emergencies that are on the ship. So in our primary healthcare clinics, we can come across emergency situations, and each primary healthcare team has their emergency bag. So that is for on land. Certainly if we need any extra equipment brought over, then that will be a process of radioing the ship. But for solely when we're on the ship and when emergencies get brought to the ship, which has happened definitely, and we anticipate it will continue to happen, then this is what we use. We do not want to grab the emergency bags from the clinics, from the primary healthcare clinics, in the case of an emergency, because everything that we need should be in this area. We're in the process of getting a crash cart, so they're like a trolley, and it's like red and it's lockable. But at the moment, this cupboard is what we're going to be using. So within this cupboard, I've already pulled a few things out. It is quite full, but we've got different toolboxes here. IV access. There's one in here that's for wound care, and one that's got diagnostic, airway, protective, personal equipment, and miscellaneous. And then we've got a lot of extra things down here as well, extra batteries. We've also got a medications little drawer with a lot of different medications in there. A great thing to know for medications is we've got our injectable drug handbook here. So for those who are going to be involved in this, it's a fantastic resource. All of the hospitals in Australia use them very regularly. We have also got, I'll mention, so we've got this AED, which is stored here. When we're checking the AEDs to make sure that they're still viable, there's a little green tick that's here. So we do that at the start of every outreach. One of the tasks is to go around and just check all the AEDs. So it's got pads inside. If you haven't used an AED machine before, which I'm sure some of you would have received the training in your basic first aid, they're super simple and they're designed to be foolproof so that any person off the street can grab an AED and follow the instructions. There's voice prompts and you can't accidentally shock someone with it. So they're fantastic tools to have. Thankfully I haven't had to use one yet. In this piece of equipment here is called a life pack. It's actually got a section, it's got an AED part to it, and it's also got a 12-lead ECG, so that provides monitoring for your heart, so cardiac monitoring. A good thing to know here, the code for it is 9999. Certainly when we get to the point of needing to use these types of things, we'll have the appropriate people down here. So for those who are leading clinics that are not medical related, don't stress out. You don't need to know the whole manual off by heart at all, but you just need to know that it's here and that it's available for use. In the situation that we do have an emergency, so we've had people come to the back of the ship with critical injuries, and this ophthalmology area, the surgical area here, is kind of like our emergency bay. During outreach, we'll have it all cleared so that there's no boxes in the way, and we'll make sure that the beds are available there for anything to happen. In the event of somebody coming to the ship, we've had it's been a Sunday night, we've just been having worship, and then somebody's come up and alerted us that someone's at the back. So it can literally happen at any time during the night. The first people that you'd want to let know would be the clinic manager or senior clinic leader, and then we'll alert the correct people after that, making sure the ship manager knows what's going on, and then we would get the appropriate medical team to come. Because I myself am not trained in medical emergency situations to a degree, so I'd be grabbing the appropriate doctors and any nurses that we know have ICU background and all that kind of stuff. So we'll get the appropriate people involved, and then we expect that there'll be somebody down here, one of the senior clinic leaders or one of our primary healthcare leaders will be always here, and they'll have a radio that'll either talk to the clinic manager or to the shift manager, so that we're constantly keeping in the loop so that we know what's going on. So if anything were to happen, let senior clinic leader or clinic manager know ASAP, or shift manager, any of those ones, so then we can involve the right people. So don't necessarily just go to a doctor straight away, because we want to track what's actually going on. That's definitely what we want to do. We've also got emergency medication guidelines here, which is essentially, it's a fantastic resource that talks about the medications that we've got, and ways in which to deliver them appropriately. So oxygen, we've got oxygen here on the ship, we've got an oxygen bottle, and we've got an oxygen concentrator. So this is a new thing that we've got here. So essentially it pulls the oxygen that we're breathing at the moment and concentrates it and puts it through the mask or the nasal prongs. So this one will live in the ophthalmology area, and then there's an oxygen bottle which is kept here during sailing, but it will be on the dental side during clinics. So they are available, and they'll each have one of these attached to them, which will have, it has a bag if we need to do bagging, and it has all the right leads in it, and face mask, nasal prongs as well. But that, if you're needing to use any of that, you'd be asking a nurse or a medical professional the right way in which to do it. What else do we have? We also have, we've got an observation trolley at the moment. It's tied up at the moment, but it has basic obs, so it can do blood pressure, oxygen saturation. So that lives in the ophthalmology area, and that will be put in the theatre when we're doing outreach, so it's just sitting there ready to go. So if somebody comes in, we can put them on observations straight away, and then if we want to use cardiac observations, we can then put the life pack up and get that going as well. But yeah, I believe that is all. Are there any questions, or does anybody else have any thoughts, ideas?